senior academics at St George's University London, or City St George's University London as we are now. And I'm first of all going to introduce you to some of my colleagues. So first of all, I will introduce you to Martin, or Martin can introduce himself. Martin, if you'd like to introduce yourself, please.
Hi there, good afternoon everybody. Welcome to this webinar. Again, thanks for your interest in City St George's, and thanks so much for your interest in this great programme we run, Healthcare Science in Cardiac and Respiratory Sleep Physiology. So enjoy the next hour, and hopefully we'll get through to all of your questions as well.
Brilliant. Thank you very much, Martin. And Martin will come back to talk a little bit about his speciality, which is respiratory sleep. So it's not just academics who will be talking to you today. We also have one of our third year students. Reem, would you like to introduce yourself, please?
Sure, I'll just turn my camera. Can you see me at all? I don't think you can. Okay, well, I'm Reem. I'm a third year student. I do respiratory and sleep science. Yeah, I'll just be talking about how I'm finding the course and stuff, and just student life in general. So yeah.
So Reem does exist. She's not just a blank space. So she is here. So I'm going to just share a presentation, and I will ask Martin and Reem to talk a little bit as well. So I'm just going to share my screen now. So just to inform you about our program at City St George's. So we actually teach two specialities. We teach cardiac physiology and we teach respiratory sleep physiology, and that all comes under the umbrella of healthcare science. And the actual course is accredited. It's called a practitioner training program, and that means that after you have graduated, you can register as a clinical physiologist. So if you are considering healthcare science and you are looking at other programs, please make sure whatever programs you're looking at have got that practitioner training program accreditation. So what is a healthcare science in physiological sciences? Well, physiological sciences covers, as I said before, cardiac, respiratory and sleep, audiology, gastro, and there are neurophysiology, and I think there are a few more. And as I said, at St George's University, we specialise in cardiac physiology and respiratory physiology. And it is a PTP undergraduate programme, i.e. it is accredited. What do you learn while you're on the course? Well, one of the most important things that you will learn while you're on the course is diagnostics. And diagnostics are tests that look at the heart and the lungs and the vascular system to make sure that the systems are working properly. We look at the electrophysiology, so the electrics of those systems. We look at the anatomy of those systems. We look at function. And some of the tests that we do are an electrocardiogram, where we're looking at the abnormal rhythms of the heart, echocardiography, where we look to see how the heart pumps, cardiopulmonary exercise tests. So this is looking at the heart and the lungs and the skeletal muscle and how it all works together. And this test is actually also used for sports science. Athletes actually use this test to see how fit they are, but we also use it in cardiology. We also look at spirometry and a whole heap of respiratory tests that Martin will talk a little bit about later. And very important, and a kind of ever-evolving study is sleep studies. And sleep studies will be looking at your respiratory system, at your cardiac system, how your brain reacts to sleep. And this has become a very, very important part of clinical physiology. The other thing we're involved in is therapies. So we're not only finding out about diseases, we're also trying to think of ways to apply therapy to make the person's heart work better or their lungs work better. And this is a very important part of our profession. We also look at research, so we might design a new therapy or test a new therapy, test a new drug, educate patients so that they can actually help themselves. And an emerging part of this is artificial intelligence. So AI is going to become a larger bit of the future for all of us. And after graduation, you can go into something called advanced practice, where you can actually run your own clinics. This might be running your own sleep clinic, running a syncope clinic, that's when people faint, um, running a chest pain clinic, and I'm sure there will be many more types of clinic that advanced practice can go into. And then there are extended roles through funded programs to become a clinical scientist or even a consultant scientist. And of course, this all is involving patient care. So you have patient contact throughout your time as a clinical physiologist. So in daily practice, what can this look like? So here we have some images of cardiac physiology. There are cardiac physiologists working in theatre environments, cardiac physiologists working in clinics and talking to patients and taking patient history, cardiac physiologists exercising patients on a treadmill and looking at their res- physiology responses, and also cardiac physiologists programming pacemakers. So a pacemaker is a device that is implanted to help a patient with an abnormally slow rhythm. Highlights of the program are professional practice. So we teach you how to be a professional in the NHS across all 3 years. This involves reflective practice and learning about how our profession fits in to a multidisciplinary team. You also have placement for clinical training across all 3 years in a specialist NHS centre, and this can constitute about 50 weeks of clinical placement training. And Reem can tell you a little bit more about that later in this webinar. We also teach you the scientific basis of all the physiology, pathophysiology, and anatomy so that you're very well grounded in all of the basics. A lot of this is shared with medicine and our other colleagues in allied health. So you get to meet the other professions that will be working in the medical field and the clinical field. And then, of course, there is the specialist theory for your chosen field. So if you choose respiratory sleep physiology, you will have specialist modules teaching you about all of the aspects of respiratory and sleep. And if you choose cardiac physiology, you will have specialist modules teaching you about all of the cardiac pathophysiology, the diagnostics, and the therapies. And you're also supervised at placement by qualified staff and educational staff at your practice site. So, Martin, would you mind just talking a little bit about respiratory and sleep physiology?
Yeah, thanks, Steph. So as Steph said, we've got this sort of direct contact with patients. So again, putting what you've learnt in the classroom into action, into practice in the clinical arena. So really exciting challenges ahead Um, this slide just shows some sleep physiology, and the course really focuses on a condition called obstructive sleep apnea, which some of you may have heard of. If not, go away and have a quick read up on obstructive sleep apnea. It's where people stop breathing, sometimes hundreds of times per night. It disturbs their sleep quality. It makes them really tired. They fall asleep at work, they fall asleep at school, they fall asleep driving their motor car, etc. And it can lead on to quite serious medical conditions, including stroke, diabetes, etc. So our year 2, year 3 students are involved in the diagnosis of sleep disorders, and there's a range of different technologies, but we can certainly see on the left of the screen setting patients sometimes in the hospital environment, sometimes in equipment now which is small, portable, which can be used in the patient's home, and actually making quality measurements of somebody's sleep. But it's not just about making the measurements, it's about analysing the data and also interpreting the complex data as well. So requiring high levels of clinical and technical skill. And we can just see at the bottom middle, there's just an example there of a sort of epoch from a sleep study. So lots of complex data. So our year 2, year 3 students are involved in setting up sleep studies. And on the far right, we've got a picture of a patient on a device. So actually, again, picking up on Steph's point about involved in the treatment, this is a CPAP device. So again, this would be used to treat obstructive sleep apnea by keeping the airways open during the night. So again, our year 3 students are involved in setting up these devices, and we've got some students setting up these devices in specialist paediatric centres as well. So this slide just gives an overview of some of the measurements in sleep physiology, but there's lots of different measurements also in respiratory physiology. I don't know if that helps, Steph.
Thank you very much, Martin. Is it possible just to go through this slide a little bit?
Yeah, of course. So again, the teaching, again, this blend of academic and clinical study. So again, you will come out of the course with a real detail, again, building on your current studies on the anatomy, physiology of the respiratory and also sleep physiology systems, but also other systems as well, which link in, where it's the neurophysiology and other systems as well. And getting this real understanding um, and this breadth of applied science, which, as I said, you can then build into your clinical practice. And as your career progresses, keep adding layers of detail to this. Um, and again, linking into these relevant care pathways. So again, the diagnostics that we perform, the treatments that we perform are real key parts of the diagnosis and the management of our patients and impact on their quality of life, their health, etc. So never underestimate your roles as cardiac and respiratory sleep physiologists and the impact you will have on your patients.
Thank you, Martin. And we're very lucky to have Martin on our course. He's a specialist in respiratory and has actually contributed to the curriculums that you're actually taught by. So as I say, we're very, very lucky. And as you can see, there's just such a wide range in respiratory and sleep, and it is a fascinating and amazing career. So thank you very much, Martin, for going through that
Did you want me
for
just to talk
us.
briefly about this slide or?
Oh, that would be lovely. You are the expert.
Okay, just very very briefly. This is just some of the different respiratory tests, and there's lots more as well. I'm sure Reem will pick up on some. But the sort of top left, we've got this patient we can see attached to a mouthpiece. They're sitting inside this cubicle called a body plethysmograph, and they can do a whole range of tests. And our job as healthcare professionals is to get high quality measurements from these patients. And this can be difficult. Our patients can be young, they can be elderly. Some of our patients don't speak English. Some may have communication, other problems as well. So we do a test called spirometry. Our year 1 students had a clinical skills session a few weeks on this before they go out on placement, giving us a sort of measure how big the lungs are, how clear all the airways are. So really useful in the sort of diagnosis of conditions such as COPD, asthma. We can measure the size of the lungs. We can measure gas exchange across the lungs, which may be impaired. We just got a spirometry result at the bottom. So again, it's about performing tests, analysing, interpreting the data as well. We are the experts in these tests and procedures. In the middle, we've got an allergy test. So again, this might be patients with asthma who may be allergic to their cats or dogs or different molds, different food substances. So again, we're involved in these procedures. And on the far right at the top, we've just got something I was teaching about just yesterday about the measurement of blood gases. So we take blood samples. We can take it from the radial artery, or in this example, from the patient's earlobe, to measure how much oxygen's in the blood, how much carbon dioxide. And again, we can see our patients, do they have respiratory failure? And at the bottom, again, involved in treatment. And this is just a patient who's using, we can see just an oxygen cylinder. So again, involved in the treatment of patients using oxygen therapy and other interventions as well. Thanks,
Thank you,
Steph.
Martin. Fantastic. And again, as Martin said, respiratory sleep, there are so many dimensions to a career in respiratory sleep, and you can specialize in one of those dimensions. And that's what's so fascinating about being a clinical physiologist. And the same with cardiac physiology. There's numerous specialities actually within the speciality. I know that sounds a bit strange, but you can maybe be running a clinic where you're scanning people's hearts, and you'll be the person performing the scans, writing the reports, which will inform what sort of treatment they may be getting in the future. Or you can work within a team. So the gentleman on the screen who's holding up a small device. This is a little device that goes under the skin and records the rhythm of the heart. And cardiac physiologists can actually be trained to insert this device into patients. It's a surgical procedure, and we can do that as cardiac physiologists. And then the other a picture on the screen that shows a gentleman being exercised on a bike. This is one of these tests that I explained before, which is a cardiopulmonary exercise test. And Martin will be very familiar with this, as am I, because this is used by both respiratory and cardiac physiologists. And we're looking at respiratory gases as well as the ECG to try and find out why maybe a patient is breathless, and we want to find out the reason for their breathlessness. Is it because their heart is not functioning properly, or is it because their lungs aren't functioning properly? And this is an excellent test for trying to find out why a patient is getting breathless. So, what's involved in the cardiac physiology program? Again, much like the respiratory sleep speciality, we teach a breadth of the application of science within cardiac physiology. We try and develop understanding of practical techniques and diagnostics and therapies, and we want you to be able to apply that knowledge in a practical way as a cardiac physiologist. And the specialisms after you graduate include being involved in pacemaker implants, implantable cardioverter defibrillators, which will shock a patient if they are having a cardiac arrest, or you can work within a team in the cardiac catheterization labs, or you can work in a clinic that investigates fainting or breathlessness. So, as I said, a wide range from performing an electrocardiogram, which is a recording of the heart at rest, to scanning the heart to look at the function of the heart, or working in a cardiac cath lab, which is a little bit like a cardiac theatre, but we don't we use very fine tubes to go up into the heart rather than open up the chest, and we can perform treatments in the cardiac catheterization lab. So I consider this as a career. Well, first of all, you have direct patient contact, which is amazing. You have time in your specialist placement, as well as at university, we teach you the academic and theoretical side. You perform a wide range of routine and highly complex procedures, and you're also involved in life-saving treatment. Even within your placement as a student, you'll come across this life-saving treatment and you'll feel part of a team that's trying to help patients who are unwell. There's a really nice environment of teamwork. You can work with patients of all ages. Every day at placement is different. And you can also look towards having further study at master's level and even possibly becoming a consultant scientist. There's also an opportunity to work overseas. Quite a few countries do recognise our degree as a good standard of ability. So that's another choice that you might want to make. Other considerations, there's really an outstanding job opportunity. Graduates get jobs very quickly and are often uh, asked to join a hospital before they've even graduated. There's a scope to progress to a senior level, and there's a scope for research and publication. And in fact, some of our students actually managed to publish their final year dissertation in some format. So what does success look like? Well, here are some of our past graduates. Parisha is a past graduate who's actually applying for consultant scientist status. She works at King's College Hospital. Chris is one of our 2019 graduates. He's actually going, is actually working now for a big American corporation as a clinical expert. And Sarah is a consultant clinical scientist in respiratory, and we have another respiratory scientist at King's College Hospital. So there are many opportunities to become very successful in this environment. So thank you very much. Just a bit of information. So our course director is Cynthia Simon. Any inquiries, just go to the St George's website, and you can find all the UCAS code and everything else on the St George's website. So I'm just going to stop sharing my screen now. And if possible, it would be really nice for maybe Martin to add anything else that he thinks is relevant at this point.
I thought that really gave a nice overview of the exciting course and the blend of academic study. I think a couple of things I would just quickly add in as well. Of course, choosing universities, choosing courses is a big decision for everybody. But I think as a London-based university, again, we've built up a great reputation, a great working relationship with lots of the big hospitals in and around London, some of the big tertiary centres in cardiac physiology, respiratory and sleep physiology. So our students get really high quality clinical training and exposed to great clinical encounters. And also I think one of the big advantages of our course, and some other universities don't do this, is you get the opportunity to get exposure to both cardiac and respiratory sleep physiology in year one, and then at the end of year one you get the opportunity to make a decision, I guess whatever floats your boat. Some universities don't give you that choice or just do the cardiac option, so yeah, it's great to have a choice.
Thank you, Martin. And I'd now like to introduce you to Reem, who it would be nice, Reem, if you just give a little bit of background about how you found the course and how you're finding it now, and also just some aspects about placement, some of the things that maybe Martin and I can't talk about because we're obviously not students. So that would be really useful.
Hi, I'm Reem. I'm in my third year, and I chose respiratory and sleep as my specialty. So I sort of picked this course because I always wanted to help people, but I wasn't really sure in what aspect. And I liked how this course allowed you to explore both cardiac and respiratory because I wouldn't know what to go into without that exposure in year one. You develop a really good understanding of so many different processes just because of the wide range of things you learn. So, for example, in year one, you have a module called Scientific Basis of Healthcare Science. And in that module, you get an overall understanding of both the cardiovascular and the respiratory systems. And then you also learn about things like the skin, just other bodily processes that you don't really cover otherwise. Um, the skills you learn on placement are also very transferable. So you'll meet loads of new people. You'll be working along professionals. It's a really good atmosphere. It's quite rewarding, I think. And some of the stuff I'm doing on placement at the moment, for example, would be lung function testing. So we do spirometry, as Martin mentioned before, and then gas transfer, which sort of looks at how carbon dioxide and oxygen are being exchanged in the lungs. And you do numerous other tests. Also, you get some insight into research. So I'm at Royal Brompton for my placement at the moment, and they're doing a lot of new trials on things such as COPD, developing new treatment plans for it. So you just get a really hands-on experience as a student, which is something that not many universities offer as well. In terms of teaching, so in year one, you sort of have 9 weeks of placement, and the majority is in uni, and you're just getting an overall understanding of everything from the biological basis. And then in year two, you cover a lot of different modules, including sort of the physics behind how these measurements are taking place. So you learn the mechanisms of an ECG, how the machines we use for lung function work. You learn how an X-ray works. You get a really good overall understanding, which is applicable for future practice as well, regardless of where you go. Uh, and then for year three, you're mainly looking for research for your final year project. So in my project, I'm researching pulmonary fibrosis, and you'll go to your placement site and either collect data there, or you can sort of do a systematic review. But it's really interesting because you get to hone in a topic that you're really interested in general, and sort of builds up all of your knowledge that you've gained throughout the years. And in terms of sort of student life, learning and tutoring is really fun. It's quite a vibrant area. You're really accessible to central London. Halls is really fun. I did that first year. So yeah, I think it's a really good balance. You feel like you're learning a lot, you're gaining a lot of knowledge, but also you're having fun as well. The social aspect is really good. And in terms of placement, you're there sort of 4 days a week, and you have a study day, and you're just learning something new every single day. So I think overall it's a really good atmosphere. Um, yeah.
Thank you so much, Reem. And Reem has also sort of helped us on career days, and comes in and helps us with some of those days. So there's some sort of opportunity to promote the course and kind of be part of the team. So the academics and the students on this course, because it's a small course, we only take 25 students. Um, we kind of know everybody. The students know all the academics, so it's a really friendly course. So I think we're ready to take questions. I'm not go to collect. I'm not sure how the questions will be coming in. So um, if Colette can help us on that, that would be great.
Oh yeah, yeah. So the questions normally everybody can write in the group in the chat if you have any questions. So if there's any
Okay,
questions, right, they can write them in the chat. That's fine.
that's fantastic. So if you have a question, if you could just type the question in the meeting chat, that would be great, and we will answer as best we can. Okay, so what are you looking for in UCAS applications to offer places? Um, I think we are three Bs, and I see we've got what the end it's three Bs. We like one of the A level at B level to be biology. We also accept T levels, and there's a sort of scientific BTEC we accept. Martin, is that correct?
Yeah, so it's our entry criteria are 3 A levels at grade B or above. But certainly on this, I'll put it in the chat in a moment. On the web page, there's a tab which goes through all of the entries. A great question, by the way, thank you. Goes through all of the entry requirements, including things like BTECs and other alternate qualifications as well. So I'll just post that in a moment on the group chat.
Yeah, that would be brilliant. We do take T levels as well, one of the few courses. Um, Personal statements and prior experience. Well, because we know that not a lot of people know about our profession, so people tend to think about doctors and nurses and maybe physios. We're actually quite um, open to whatever experience people have had. So if people aren't very sure, and maybe they want to do physiotherapy or they want to do nursing, we will actually interview people even if they haven't actually chosen or they don't really know that much about healthcare science, because we do understand that it's one of these professions that people don't really know that much about. So we're quite open to people who want to work with patients. They're really interested in technology. They're interested in diagnostics and therapy. And we find that some people who never knew, I didn't know this existed before I became a cardiac physiologist. And so I think in your personal statement, if you are somebody who wants to work directly with patients, if you're interested in technology, if you have attention to detail, if you want to make a difference in people's lives, then I think all of those things will do you credit if you're applying for this post. And are there any questions you want to ask Rima just about student life as well as the course? Just go ahead and ask us.
So in first year, you have mainly lectures, and your lectures are also combined with medicine students and other specialties, like Stephanie mentioned. In terms of schedule, I think it was so you're sort of in Monday, Tuesday, Thursday, and then Wednesday you have a self-directed day. Friday can be, I don't really know. I don't know, depending on the day. Um, but it is mainly lectures, and you also have some group work. So you do some presentations in year one because for year two, you actually have a presentation and group work which goes towards a module. So you have sort of a practice on that. In terms of practices, do you mean like clinical skills before placement? Like learning how to do an ECG, is that what you mean? Because we did have a couple of sessions on that. Um, and same with lung function. We learn about pulse oximeters and different sort of techniques for spirometry. But most of the knowledge you learn will be applied on placement. So you'll get a lot of practice there then. And the interview process. When I had my interview, I did my interview with Martin, I remember, and he mainly asked me questions about my personal statement, um, and just why you're interested in the course. I know there are multiple mini interview format now, but I'm not sure if I had that done when I applied. I didn't.
Mhm.
Yeah.
Yeah,
So
so we have MMI interviews now, and on that panel will probably be me, Martin, uh, maybe the course director, but we also have previous students come in to help with the interviews, and also some of the clinical staff from the placement sites. So they're all people who are very interested in the program, who really want to, help people get through the process. Um, it's I wouldn't worry too much about the MMIs as long as you come with an open mind, and just listen to the question and answer it as best you can. We find that people do very well. So, will there be exams or coursework? Yes, bit of both. There are end of year exams for most of the specialist programs. Martin and I are working quite hard to make sure there's a bit more coursework, so maybe essays, so you get a bit more practice in the second year, so that when you write the dissertation, you have a little bit more idea how to write a professional academic piece. All degrees expect independent study for the course. I would say, however much independent study you would do for your A level or your BTEC, then you're definitely doubling or tripling that, whatever degree course you're going to do. And I imagine that Reem probably has a view of this in the first year. I think for any undergraduate degree, you really don't realize how much independent study you need to do. By the time you get to the third year, you understand how much independent study you should do. But we will always be there to help and advise you. When will interviews start being scheduled? I think the first interviews are in February of this year. So yeah, so if you want to apply, I think applications are open now, so apply as soon as possible, and we will start interviewing in February. Resources, we have an amazing library. Almost all the books are online. You don't have to buy them. You can read them online. And we also have our own clinical room, and I'm hoping that we will have more clinical sessions arranged in there. Martin, you got anything to add?
No, I think they're great questions. Just on the sort of coursework exams, you certainly can't get away from them. But just to add the sort of and Reem picked up on it as well, the sort of final year research dissertation, which is a huge piece of work. We do some students prepare posters, presentations, and also in the clinical training as well across all years, students complete a portfolio of evidence as well, which of course needs to be passed. So really a good wide range of different assessment strategies. So it's not all exams. There's a huge range of different techniques.
Thanks, Martin. And yeah, the poster presentations from last year actually were so good from the second year cohort that they got presented at a university education meeting, and all of the students received a certificate to say that they had being part of this wider education meeting by the university. So there's some really useful outcomes of some of the assignments. I think that benefit the students as well.
Steph, can I just pick up on the support sessions as well? Just a quick point to add as well, that all lectures are recorded as well. So for example, if students are unwell and they can't attend a lecture, they can still go online after the session to actually listen to a recording of that lecture if they've missed it, or that may help with their revision as well. So there is support there as well. And of course, just going slightly off topic as well, everybody does have a personal tutor who is there to support. We know sometimes university can be challenging, so you will be given a personal tutor throughout your degree course to be there to support you throughout. That's a good question.
In terms of challenging, what is the most difficult part of this course? Clinics, subject. Oh, well, I think Reem, I think I think Reem is the best person to. I have my own ideas, but Reem, what is the most challenging part?
You can't
Well,
say me.
I'll try not to. I think the most challenging part I found was I think first year was really fun. Although you had a lot of topics, a lot of learning, it was just a really good experience overall. I found year two the most challenging simply because of the balance. You have a lot of placement, but you also are sitting 5 exams at the end of that year. So I think it may not even be difficult to understand. It's just the amount you have to learn, basically. I don't think it's the difficulty in terms of the topic, because it's really good. You've got a lot of support, you've got a lot of resources. It's just you're balancing being at placement majority of the week along with studying for those exams, which are basically what you're going to get by the end of the year. So yeah, I don't think it's like a certain part. I think combined is what makes it difficult, if that makes sense.
Yeah, I would agree with that. I think yeah, year two is heavy in content, but you're also at placement trying to learn some complex techniques and be part of that team. So I don't know whether year three comes as a sense of relief, even though it's a lot of placement, but you
Mm.
have fewer modules in the third year, and they tend to be kind of very interesting things. So though it becomes quite complex, it's like you're really beginning to feel like you are a clinical physiologist. Um, I imagine Reem now probably feels that she
Yeah,
is a respiratory sleep physiologist. You know,
yeah.
you actually transform from a student into a professional, um, which is amazing for us as academics to see, I have to say. But yeah, that second year is quite tough. I will agree with that.
But we have just cut a module out of year two, Reem. So
Oh,
and
really?
I know you sort of missed that, but we are always sort of reviewing the content. I think it's scientific basis of healthcare science free has
Yeah,
now gone. So we are
Okay.
aware of the busy year
yeah.
two, and but it is a challenging course, and
I would say that
yeah.
that's one of the things because we're a small course and you know, we take a small cohort of students. We tend to be very reactive to students' commentary, and because, as Reem said, year two was, you know, people got through year two and they did well, but we've taken on board the commentary and we've actually, you know, taken a module out and
Mhm.
scheduled it across the year. So hopefully that will help. So what key skills will I gain during this course that will help in the real world setting? Well, by the time you're in the third year, and again, I think Reem will be able to comment on this,
Mhm.
our students at placement are thought of by placement as part of the team, and they're pretty much trusted to perform diagnostics and to be involved in the multidisciplinary teams. And some of the skills you might learn as a clinical physiologist are being able to perform complex tests, being able to be part of a team that comes in to help patients survive heart attacks. You learn some um, uh, life-saving skills from basic life support to immediate life support. So that is when a patient has a cardiorespiratory arrest, you will know what to do. Um, so you learn some very, very high level skills that can be instantly applied as soon as you graduate.
Just to
Martin,
pick up on, sorry, do you want to go first, Martin? I didn't want to interrupt you.
No, after you, Reem. After you,
Okay,
please.
thanks.
Students first.
Just to pick up on what Stephanie's was saying, a lot of the skills you learn on placement, such as something small like interpersonal skills, can be transferred to any job or role you go into. Like, I found that my confidence on placement built a lot, and it just helped me in real world settings as an everyday life because you need to be able to talk to people, show empathy, use your initiative. Those are things that you'll need regardless of what sort of field you go into. So I think it is so useful to be able to gain those skills early on for sure.
Yeah, I would just add on. I think that's a great question. Again, the sort of people skills, the leadership skills, the teamwork, the analytical skills, also the sort of balancing your workload, your clinical duties, your academic duties, but managing your life as well. There's a life away from academic studies. It's about being a student as well. And also that just picking up on leadership as well. We're just looking at placements for our new year one students. And actually I'm liaising with one of our past graduates who's now managing a big community diagnostic centre in East London. So actually to see how students develop as people, to develop as scientists, as clinicians, I think for me that's one of the best parts of my job. and people grasping these opportunities. So
Yeah,
yeah,
it's amazing to see people who graduated, 4 or
yeah,
5 years ago to be so successful in their clinical
yeah,
scientist uh, career.
yeah.
Um,
I think,
what?
Steph, we know as well, some of these students come back and now they're actually teaching on the
Yes,
program as
yeah,
well. So they're
yeah, yeah,
developing the
yeah,
academic, the research skills as well.
yeah.
So,
I have
um,
people who come back and
yeah.
lecture who used to be students with us. So, what criteria do you use to select applicants? I would say at, at MMI when you get through, I think if you have the correct qualifications, we will probably ask you to interview. As I say, the statement um, these days for us probably isn't the most important part, but I would say when you come for your MMI, I would practice your communication skills. So, what's probably a good idea is to do some pretend ones with some friends and sit around and get a friend to ask a question, and then just try and talk to that question for I think it's about 3 or 4 minutes. Because what we have to be as clinical scientists, because we're working with patients, we have to be great communicators. We have to be able to listen and understand what's happening with the patient, but we also have to be really good communicators. And part of our role is to take either a very focused clinical history or an expanded one. So during the course, will we conduct ourselves real world clinics with real patients? Yes, absolutely. From the first year, we will do a bit of clinical training with you. We'll make sure that you understand how to speak to a patient. We do a clinical history taking workshop. You learn how to do ECGs, spirometry, um, but you also learn how to speak to patients. So from year one, you will be in the real world clinics with real patients. Absolutely. Um, and your contact with patients and your contact with multidisciplinary teams will just become more and more complex until the third year. So yeah, from the off, I think you start at university either September, October. I can't remember when the start date is, but you're seeing patients from February. So we don't throw you in the deep end. We throw you in the shallow end. I don't know whether Reem or Martin have got anything to comment on for that.
I think that's just the best part of the course, actually putting what you've learned in practice. And as Steph said, in February, our year one students will be going out on their very first placements, and starting their journey.
Yeah, and I think it just eases you in. You're not just thrown in there. You start seeing maybe one patient and then you get used to it, you get used to the conversation you meant to have beforehand, the history, and it just becomes like second nature. So yeah, you definitely will be observing real world clinics.
Yeah, and I think as Reem said earlier, it's the great thing about this course is it does improve your communication skills for every aspect of your life, which is a great thing. If you're working clinically, whatever profession, and yeah, we're talking about clinical physiology here, but if you were a physiotherapist or a radiographer or any of these professions where you have to um, talk to patients, then you know it's really a good skill. What percentage of graduates go on to work in a cardiac facility versus pursuing more advanced? Um, I would say almost all of our students go into or get a post in the specialism that they have um, studied in. So whether they go on to do a master's immediately or whether they choose to do a master's in 3 or 4 years' time is kind of up to them. There is a funded master's. It's quite difficult to get onto. You probably need a first or a 2-1, but you can pursue a master's after you've been working 3 or 4 years. A lot of NHS trusts will actually pay part of your master's or all of your master's. So quite a few people now do actually go on to do a diploma or a master's or a postgraduate course. There also are professional qualifications. So there are professional qualifications run by the respiratory professional body, and there are professional qualifications run by professional cardiac physiology, and they also, I think, they also can be funded by the department you're working in.
And just to add as well, we've had several students who've gone on and got places onto graduate entry medicine as well. Again, like STP, it is competitive and there's no guarantees, but we've got students now working as doctors, clinicians, or actually doing their medical training. So the course does open up lots of opportunities. But I would think about 85, 90, probably a little bit more go on to work in cardiac or respiratory physiology, and a smaller number go on to further study. We have got one student who's working in respiratory sleep physiology, and she's actually just started a doctorate, a PhD in cystic fibrosis as part of her employment as well. She also teaches on the course as well.
Yeah, there's a lot more people now going into research, going into further education. It's actually encouraged by many of the departments, and there's a very good career structure. The great thing about the professions is there is actually a national shortage of qualified staff. So it does mean that you probably could work in any part of the country that you want to, because of that. And also, these qualifications are thought of quite highly in places like Australia and New Zealand, and in I think in South Africa as well. So there are opportunities to go and work abroad. I think also places like Dubai, Bahrain, a lot of the Middle Eastern countries have quite a lot of respect for our degree. So there is an opportunity to work abroad. So I think we only have 5 minutes left. So just looking to see if we've got any other questions coming in. And maybe in the last, finally, are there flexible learning schedules online between those? I wouldn't say necessarily flexible, but because we record all of our lecture sessions, um, it's always nice to attend a lecture, because especially if we have guests or we have a very complex session, it's quite nice to be there so you can ask questions. If we have one of the highly specialist clinical scientists who come in to do a talk, it's really nice to come in because, again, you can ask them questions. However, the sessions are recorded, and you can engage with them slightly outside of the live session. So I think it'd be nice for us to say goodbye. So Reem, would you like to say goodbye or any last words?
Nothing really to add, but I think if you're thinking of applying, definitely just do it. Just put yourself out there. I'm sure that if it's meant for you, it just will be. And I think also you won't regret it, because you just learn so much and you're continuously learning. Even now, I'm still learning so much. So I feel it just really benefits you as an overall person as well as your future. So yeah.
It's a great profession. I was a cardiac physiologist for many years before I became academic, and yeah, it really is a great profession. So thank you very much. I say goodbye and have a good rest of the evening.
And good luck with your current studies as well. Get the grades that you need, deserve.
Apply.
Work hard, and hopefully we'll see you at St George's.
Yeah, it'd be great to be interviewing you in February, March, April.
Then you can find out what MMIs are all about.
Yeah. So thank you, everybody.
Bye.